The upper limb, also known as the upper extremity, is the part of the body that extends from the shoulder to the hand. It provides us with a wide range of motion and allows us to perform many essential tasks. In this video, we'll be looking at the breakdown of the gross anatomy of the upper limb. The various components of the upper limb include regions, joints, muscles, blood supply, innervation or nerve supply, and clinical implications. The regions of the upper limb are mainly three. They include the pectoral girdle, the arm, and the forearm. The pectoral girdle is a bony girdle that connects the upper limb to the axial skeleton, which is the trunk. It consists of two bones. There are the clavicle, which is also known as the collarbone, and the scapula, which is the shoulder blade. The clavicle is a slender, S-shaped bone that connects the sternum to the scapula anteriorly. The common name for the sternum is the breastbone. As for the scapula, it is a flat bone that is triangular in shape. It is located on the back of the shoulder. It provides attachment sites for various muscles that are involved in arm movement. The next region of the upper limb is the arm. The arm is the uppermost segment of the upper limb, and it extends from the shoulder to the elbow. It contains one bone called the humerus. The humerus is actually the longest bone in the upper limb, and it is responsible for arm movements like flexion, extension, abduction, which is the raising of the arm away from the body, and adduction, which is the bringing of the arm towards the body. The third region is the forearm. It is the region that is between the elbow and the wrist. It contains two bones, that is the radius and the ulna. The radius is located on the thumb side of the forearm, and it is responsible for the forearm rotation movement. The ulna is located on the little finger side of the forearm, and it provides attachment points for the forearm muscles. It articulates with the radius at both ends, allowing forearm rotation. The next component of the upper limb is the joint. The upper limb has several joints that allow for a wide range of motion. The common joints of the upper limb includes the shoulder joint, the elbow joint, and the wrist joint. The shoulder joint is also known as the glenohumeral joint. It is a ball and socket joint formed by the articulation of the humerus with the scapula. It is the most mobile joint in the body and allows for a wide range of motions, which includes flexion, extension, abduction, adduction, and circumduction. Circumduction is simply a circular movement. For the elbow joint, it is a hinge joint formed by the articulation of the humerus with the radius and ulna. It allows for flexion and extension of the forearm. The wrist joint is a complex joint formed by the articulation of the radius and the ulna with the carpal bones. There are 8 carpal bones in the wrist. The job of the wrist joint is to allow flexion movement, extension movement, radial deviation, and ulnar deviation. Radial deviation is a movement in which the wrist is bent towards the thumb, while ulnar deviation is a movement in which the wrist is bent towards the little finger. Muscles are the next component of the upper limb. These muscles of the upper limbs are broadly categorized into 2 groups. There are the flexor muscles and the extensor muscles. The flexor muscles are located on the anterior aspect of the upper limb. These muscles are responsible for flexion movement at the shoulder, the elbow, and the wrist joints. The extensor muscles are located on the posterior aspect of the upper limb. These muscles are responsible for the extension movement at the shoulder, elbow, and also at the wrist joint. Flexion movement simply means bending, while extension movement simply means straightening. There are so many muscles of the upper limb, but some of the major muscles of the upper limb are the deltoid, the bicep brachii, and the tricep brachii. The deltoid muscle is the large rounded muscle that caps the shoulder, and it is responsible for shoulder abduction. Bicep brachii is also a large muscle. It is a 2-headed muscle on the anterior aspect of the upper arm that is responsible for elbow flexion and supination. Supination is just the rotation of the forearm so that the palm can face upwards. The tricep brachii is responsible for elbow extension. It is a 3-headed muscle on the posterior aspect of the upper arm. For the blood supply, the upper limb receives blood supply from the subclavian artery, which branches into the axillary artery and then further branches into the brachial artery in the arm. The brachial artery is further divided into the radial and ulnar arteries at the elbow, supplying blood to the forearm and hand. For the nerve supply, the upper limb is innervated by the brachial plexus. The brachial plexus is just a network of nerve formed by the front branches, that is the ventral rami of the lower cervical spinal nerves, which are the C5 to C8, and then the first thoracic nerve, which is the T1. These nerves branches out to innervate the muscles, the skin, the joints of the upper limb. The clinical implications are basically conditions that will arise when there is a damage of any part of the brachial plexus, such as the air palsy, the winging scapula, and others. Don't forget to subscribe and share. We will see in the next video.